strength, honor, fearlessness. When thinking of these pronouns, most would assume these are the qualities of a brave, strong man. But how about words like fragile, emotional, and sensitive? The most obvious character in mind would be of a nurturing woman. The theory on sex and gender from the third edition of Looking Out, Looking In reflects stereotypes norms on males and females, and how we as a society are labeled from birth under pronouns that we have to abide by, live up to, and fulfill. Welcome! This presentation is brought to you by Fikria Fikrat and Asra Siddiqui. Our topic is on sex and gender, and how we as individuals categorize children from the birth indirectly by using gender-specific pronouns as we communicate with them. Following the topic on gender and sex, we will be taking a closer look at the outcomes of placing these names on children with using men as nurses as an example in society today, and also women as doctors and their impacts on the health system in today's society. The sex and gender theory deals with the importance of gender shaping our sense of self along with the way others communicate with us according to our gender. It's evidence to see that the gender and communication go hand in hand as they're an association of different pronouns and gender-related nicknames used between males and females. When it comes to men, words that are associated with them are usually size, strength, and activity. And in real world, they are looked as a person who is secure, mature, and independent, while women who are associated with beauty, sweetness, and visual responsiveness are depicted as someone who is well-rounded, intelligent, and passive. And quite frequently, people will act in a way that abides to the gender stereotypes laid out to them in all aspects of life. The theory also shows how gender differences are associated with self-esteem, and that male adolescents have higher self-esteem than their female counterparts, in a recent study done at a Canadian secondary school. And thus, this shows that pronouns or names associated with gender are linked to the expectation put on them. It is evident that many men think that nursing is an occupation for females, or they think that others believe that, and this holds them back from what could be a very satisfying career. Society assigned men more authoritative roles, such as doctor, and women were assigned nurturers. But the idea that nursing is for women is a myth, and it's time to put that myth to rest once and for all. However, with the current nursing shortage, healthcare leaders, hospitals, associations, and colleges are realizing that good nurses are hard to come by, regardless of gender or nationality. And male nurses today are finally getting the respect they deserve. And more men are recognizing the fact that the time and switching careers to become nurses. Right now, men make up around 9% of all nurses, but that's a huge increase from recent decades. In fact, the percentage of nurses who are men continue to climb every year. By some reports, men now make up nearly 20% of all nursing students. With the number of men in the nursing profession increasing, it's likely they could expect a stronger presence within the nursing associations, organizations, and places of employment. Another practical application to the health system today is the increasing number of women in medicine. The Medicine and Social Justice blog post online says that there has been a steady increase in the number of women in medical school for the last 50 years, and that women now comprise 43.5% of graduates of U.S. schools. It was once thought that doctors were considered as a male's occupation, But now, as more and more research is coming out, it turns out that it's a good thing that women physicians enter primary care at higher rates than men. Because we need more primary care physicians, since female physicians demonstrate better communication skills and include more preventive care than their male counterparts. But there is a drawback to the increase in the number of women who are being physicians. The authors also note that recent reports identifying lower productivity among female physicians have doubted whether more women in medicine will worsen a shortage of physicians by limiting patients' access to care. In general, women are less likely to work excessive hours, and thus physicians see fewer patients per hour or to work past the typical age of retirement. But at the end, it's the quality of service and not the quantity of service. So seeing more patients more frequently may not increase the life expectancy of those patients, but spending more time with each patient, hearing and listening more effectively, and including more preventive measurements, all characterized identified in studies of female physicians, may result in fewer but more effective clinical encounters rather than greater volume of encounters. So, to the extent that having more women in medicine leads to more primary care physicians, and because of the convincing evidence that a system built upon primary care leads to improved health outcomes and the quality of the care they provide may result in improved population health. We are living in a world where the pronouns appointed to us are meant to govern the way we live our life. Since birth, we are labeled due to the gender we are born in, and expected to fall into our given rules, whether that be the strong male figure or the sweet and innocent female. These are the stereotypes allotted to us by society. As time progresses, we are slowly breaking out of these molds and forging new paths for ourselves regardless of our genders. And this can be seen through the examples presented above in respect to our health care system.